what is the challenge around adolescence? There can be many of those, but where I want us to start off with is the challenge that this is some research by Lisa Dixon and colleagues that found that up to a third of people given a serious mental health condition diagnosis will disengage from treatment. And that is especially true of people who are younger, who are male, who are from an ethnic minority background, or who have really low social engagement and social functioning. And so the call from Dixon and colleagues is for how is it that we can engage people, especially these young people, in treatment and keep them engaged. And there's a call for recovery-oriented approaches that are very personalized to the individual. And this is especially important because of young people who were experiencing early episode or first episodes of psychosis and serious mental health challenges. They did an interview and found that these individuals experience a significant loss of identity, sense of self in this process. So these are young people who may have been going through their earlier development with a sense of there are things I want to do or places I want to go or people I want to be with. And then these different experiences related to mental health and just the experiences they have, we are going to discuss trauma here in a little bit, impact how it is they start to see themselves and possibilities for themselves. So an identity is one of those core features of adolescent development. When we think about adolescent development, we're thinking about the time where we discover the things that we like or don't like. We discover, kind of pieces of who we want to be. It's a very exploratory time. So this sense of a lost identity at an early time in our life is an important piece. Related to identity, when it comes to clinical work, clinicians also are seeing that this is a problem and the people I'm working with are having a difficult time kind of formulating the sense of identity or feeling stuck or loss of identity, and clinicians are reporting low confidence to address this issue. And with this challenge of identity also comes stigma. So stigma in terms of how it is that I'm internalizing my experience, as well as stigma that I might be experiencing from other people. So there's some research that shows that the more that it is that people experience this internalized stigma, sense of I'm broken. There's something defective about me, that my brain just doesn't work like other people's. Those who hold those stigmatized perceptions of self, they tend to experience challenges for longer. The higher the stigma is, they tend to have poor social functioning, which is such a critical part of just all of our human experiences. And they also experience more of the symptoms associated with these diagnoses. Now, thinking about a cognitive therapy perspective, the beliefs that we hold about ourselves, about other people, about the world, and how that impacts us, the impact of stigma is huge. So this can be, again, beliefs about being broken or a failure, or beliefs that I should just give up on all the things that I've ever cared about or wanted to do for myself. And the accompanying experience of feeling just completely deflated, defeated, embarrassed. You might hear people labeling themselves in terms of, well, I'm crazy. Crazy people can't do things. And please hear me that when I'm saying this is the things that people are saying about themselves. Absolutely not a perception that we hold in this approach or personally. But those are the things that can ruminate and can contribute to, well, if there's no point, or if I can't do the things I wanted to be able to do before, why should I continue to engage? So we see that increase in isolation and withdrawal, the disconnection from social relationships, family relationships. And in adolescence, especially those who are at risk for or may go on to develop these serious mental health condition diagnoses or be given those, isolation, withdrawal, kind of reduction in energy and motivation, reduced access to motivation are some of those early things, the first things we see. And we can connect that very significantly to those defeatist perceptions at what's the point? I'm not going to be able to do things I cared about. In terms of stigma that can come externally as well, I have had several situations where the perceptions that the young person has come directly from interactions with family or other members of their communities. And this includes, different cultural or religious backgrounds, as well as just kind of misunderstanding about mental health and things of that nature. I was working in a hospital setting. This was probably about 10 years ago now. And there was a young person, 18 years old, and all of their discharge plans from the hospital went out the window because the family came and said, we cannot have this in our family. So stigma is maybe internalized and assumed based on perceptions from media or just misperceptions on my own end, but also can very directly come from these outside sources. Another piece of the challenge we have to acknowledge is the role that trauma plays in this process as young people are navigating mental health systems and difficulties. And one important piece is that when it comes to trauma, there's a tremendous amount of research that shows that people who have been given serious mental health condition diagnoses experience trauma at a quite high rate, oftentimes multiple traumas. What we see here is in this large study of community mental health setting is that 80% of the participants reported experiencing at least one traumatic event and 70% reported experiencing two or more. And if you think about your own clinical work or your life's experience, I have to imagine that would resonate with you all as well. And a really important piece of this is that 70% of people reported not wanting to talk about it. So again, thinking about the dropout from treatment, the engagement with others, and the stigma and identity concerns, all of this can come together in a place where also I really am concerned or reluctant to talk about these things, because what is that going to say about me if I do? How are other people going to perceive and receive me if I do? And thinking about adolescents specifically, trauma may look different. There may be different things that we need to consider here. So when we think about what are the difficult experiences that adolescents and emerging adults might face, social isolation and social rejection, being bullied, being told, why do you think like that? That's so weird. Any of those types of experiences, however small from the outside looking in they may seem, can have a tremendous impact on the way that the adolescent is taking this in and developing that sense of who they are as a person. So now my identity development phase is being collided with these perceptions of others. Possibly hospitalization, depending on the degree to which the challenge is presenting itself, and interactions with emergency departments, crisis centers, authorities like police. All of these different things can be perceived as traumatic. Okay. When we are, hold on one second. No, I thought it skipped. It did not. Okay. Another thing related to trauma and young people, especially those at ultra high risk for going on to develop these mental health conditions, is that we found that minor daily stressors will contribute to an exacerbation of the challenges that they may be experiencing. And the greater the levels of trauma, the more intense those experiences become. And that includes hallucinations and delusions and just in general, more intense, distressing, negative emotions, anxiety, depression, overwhelm. And there's when there's less positive emotion in response to stress, or just like not really having a higher degree of poor stress tolerance, there we go. Then there's, again, a correlation with higher severity and poorer functioning. These are some of the beliefs that we're considering from that trauma perspective. The idea that young people may feel like there's something about me that is defective, that is broken. The things that have happened to me are my fault. I'm worthless. I can't trust other people. Other people are out to get me. The world is unsafe, and what's the point? So we're going to be keeping those in mind. context in which we're seeing young people is also going to be incredibly important to the approach that we take in recovery-oriented cognitive therapy. And so we want to be, and as we're developing our formulation. So part of our formulation involves when is it that we see young people in treatment. Oftentimes we are seeing adolescents and emerging adults in treatment because someone has told them they need to go. They've been told by parents, by teachers, counselors, coaches, you need to go and talk with somebody. We're concerned here. Sometimes seeing them in treatment comes after a very significant event, possibly related to trauma, like I just referenced. This could be because of not going to school and getting in trouble with the school system here. We term that the truancy courts. Criminal justice involvement, getting into trouble with the law, hospital involvement can lead to this. And then here where I am, we have the Department of Human Services or kind of Child and Youth Services who do the outreach when there's concerns about how children are being treated in a home. So it's possible that there are Health and Human Service and equivalent groups that say, you have to do this. And then sometimes we see adolescents in treatment because they request it. Here, where I'm located in Pennsylvania in the United States, the age of consent is 14, meaning that a 14-year-old can come in and say, I want to have therapy. They sign their own forms. They are the owners of their consent and their confidentiality. And so that is sometimes the context that we will see them in as well. But we can see how this then impacts the way in which they are navigating things because they may have perceptions about not having control. So now I'm having these experiences I might not feel like I have control over. And I am being told that I have to do something about it, which is another time where I'm being told I don't have control. And everything in me wants to experience autonomy and independence. That is another core feature of adolescent development, is that quest for self and independence. And so I don't have a lot of control could be a big factor. Or perhaps I'm seeking control by doing this for myself. And this can really impact their involvement with this process. Now, results show that for individuals like James, who I introduced at the beginning, ultra-high-risk youth have a lot more negative beliefs about themselves and others, and a whole lot less positive beliefs about themselves and others. And that may not be too surprising given all that we've talked about, but I think that it's incredibly important because in CTR, one of the things that we're going to be doing in our partnership with these young people is we're going to try and cultivate experiences together and motivation for them to engage in experiences that really strengthen their positive beliefs about themselves and really neutralize or kind of work against those negative beliefs.